Hey guys, what's up and welcome back to my channel. If you're new, thank you so much for being here. I hope that you would subscribe and join the family. If you are not new, welcome back. Thank you so much for joining and just being a part of what I am doing on here. Today I'm going to be doing a video of my undergraduate degree, basically what I did in college. Should you consider it? Should you not consider it? Is it your speed? Is it not your speed? What job security looks like in the field, how much you make as an entry level MLS, what courses you need to take, and I'm basically doing this video because currently I am doing research on what I want to do in my graduate degree, and one of my research tools has been YouTube. So I would come in here to see what people have to say concerning a particular degree, and I'm like, oh, I could actually do a video of my own degree. So I guess that this video will be beneficial to like high school students looking for what to do in college if they're interested in a health related course, or I guess if you're in college it's an undecided major, or if you're done with school and you want a graduate degree in this degree. So yeah, stay tuned. So first things first, a little background. I've always been interested in the health field. That has been something that has sparked my interest ever since it was time to choose career. So boom, I wanted to be a doctor. So I guess that was like the next thing to do. But in the United States, you have to do a undergraduate degree in a 4-year course before you apply to med school. So I guess like biology or chemistry, or like a pre-med track before going to med school. And during my applications, biology was at the forefront. That was something that I wanted to do before going to med school. But my dad told me about this program called medical technology, and I'm like, what is that? So I did my research and I realized that it was much broader than what I thought. Had a lot of opportunities, and in case I changed my mind for medical school, it was a professional course that I could actually practice right out of college. So boom, what is medical technology? So medical technology, or medical laboratory science, or clinical laboratory science, because these are all names for it, is the study of body fluids to diagnose a disease. We are basically the behind the scenes of medicine. We do not have patient contact. We basically analyze body fluids such as your bloods, your urine, stools, respiratory fluids, your abdominal fluids, tissues, bone marrows, analyze all of that and give the physician information as to what is going on with a patient. So in simpler terms, a way to think about this is, you know, when you go to the doctor to get your blood taken or your pee taken and they send it to the lab, we are basically the ones in the lab analyzing these things to tell the doctor what is going on so they can know how to treat you. Another way to think about this is when you need blood transfusion, or when you need a new heart or a new kidney or new liver, we are basically doing the test to make sure that you're compatible with the new one you're getting. What percent of the population's blood you're compatible with. Should you get this person's blood? Should you get this person's heart? Should you get this person's kidneys? Should you not? And yeah. A lot of people always think that medical technology is the study of the instruments that the doctors use to take care of patients, I guess because it's medical and technology, but honestly it's none of that. There are various aspects to it, and if you decide to major in this course, the first 2 years are your general education classes and organic chemistry for health majors, so not the real organic chemistry, which is organic chemistry 1 and 2. You also get to take biochemistry and a class called Introduction to Medical Technology. The next 2 years are your main medical technology classes and an opportunity to rotate in different aspects of the lab to see what you're interested in. So I went to Morgan State, and the last semester was a 20-week rotation at different hospitals. The main medical technology classes are microbiology, clinical chemistry, hematology, blood banking, and immunology. So after these classes, you then get to rotate at the hospital and I guess correlate what you're learning in class to what the hospital, so real life patients. So I rotated at big hospitals like University of Maryland and Johns Hopkins, and it was really interesting because I got to see like all kinds of sick people, all kinds of cancers, all kinds of clinical cases, and just correlate what I learned in class to real life, and that was amazing. So after the medical technology program, you're required to take a certification exam so that you could practice the field and be licensed. depending on your job, they give you time to take it upon graduation. So I took this exam 3 weeks after graduation, honestly, just to get it over with. I felt like the longer I waited, the more I'll forget all of the things I learned. The name of the exam is the MLS ASCP, which is the Medical Laboratory Science, and the ASCP is American Society of Certified Pathologists. This program is challenging, honestly, like anything else in the world. You cannot finesse your way. You have to know your content, you have to know what you're doing, you have to know, you know, the work, I guess, to get it done. But it's worth it. Morgan really gives you what you need to know and prepares you for the exam, and also prepares you for your rotation. So I feel like I knew my work, or I knew my content before taking the exam, and also before my rotation. So job security, there's 100% employment rate upon graduation in this field. Y'all, this is not a sponsored video by my job or by my school, but you're guaranteed a job after graduation. One, because it's healthcare, and two, because not a lot of people know about this program, so there is job availability in this field. It's a very broad course compared to bio or chem, because it gives you the opportunity to be certified once you graduate. Even if you decide not to go to school after, there is a lot of things that you could do. There is room for moving up, because they call us MLS, which is Medical Laboratory Scientist. At an entry level, you're an MLS 1, and once you move up, you could go to a 2 or 3. You become a lead, a manager, a supervisor, an educational coordinator, a clinical analyst. There's a whole bunch of stuff that you could do. And even if you decide to go back to school, you could do med school, pharmacist school, PA school. You could study bioinformatics, biotech, epidemiology. There's a whole bunch of stuff that you could do, and it could be overwhelming because it's like, what exactly do I want to do? Yes, it's an amazing program. Honestly, if you want to go to med school, it gives you a lot, or an edge over a lot of bio or chem majors, because you know a lot. Like, I would sit in class and be like, wow, like I know all of these things. You could honestly do a lot. Like, I would sit in class and be like, wow, I could do some Grey's Anatomy right now. Like, it's a lot that you learn, and going to med school, you already know a lot. So is this course good for me? Honestly, if you're interested in med school and you're looking for a pre-med course to do, I think this is an amazing program to, you know, get started with. If you're interested in healthcare stuff, but you don't want all that patient interaction, I think this is amazing. If you're interested in healthcare stuff, but you know, you don't know what you want to do as of yet, I think this is amazing to get your feet wet into the waters to see exactly what it is. And you could honestly switch if you do not like it. I always work for this program because honestly, I have never looked back from it. But I hope that, you know, do more research to see if that's really what you want to do. The most common place to work with this degree is the hospital setting, because that's definitely where all the labs and patient stuff is. But you could also work with government agencies, National Institute of Health. You could work with forensics and all of that stuff as well. Experience is really important in this field because it opens a lot of doors to areas and aspects that you might be interested in later. I don't know if I said this before, but upon graduation, I've been working in the microbiology lab. That's the aspect I chose, micro, because that was the most interesting for me. So I've been working in the microbiology pathology lab for 3 months now, and it's been super interesting. Just learning a lot and gaining experience. But yeah, that is, you know, all of it for now. I hope that I've been able to shed more light on this program. I hope that, you know, consider it or do more research and see if you're interested in it or not. And yeah, that is all of it for today. Thank you guys so much for watching, and I will see you guys in my next video.